us for the recent rain we've got, and we just pray that you'll continue to provide us with more rain and help the people who are needing it. We ask that you watch over the people who got too much rain and struggling with floods, and we can help them. Lord, help us and guide us and give us wisdom to guide this county. This we pray in Christ's name. Amen.
Amen. Take a roll call.
Chris?
Yes.
Dennis?
Yes.
Al?
Yes.
Jerry?
Yes.
Scott?
Yes.
Marge? Gary T?
Yes.
Jimmy?
Yes.
Hank?
Yes. Okay, you wanted to receive your court packets, and in the packets was the reading, or I'm sorry, the minutes from the last meeting. And if you've reviewed those minutes, I'll accept the motion to accept the minutes.
I move we accept the minutes.
Jerry made the motion, Dennis second.
Chris?
Yes.
Dennis?
Yes.
Al?
Yes.
Jerry?
Yes.
Scott?
Yes.
Marge? Gary T?
Yes.
Jimmy?
Yes.
Hank?
Yes. Next is the clerk's report. You reviewed that. I'll entertain a motion to accept the clerk's report.
Make a motion.
Second. Gary made the motion, give me a second.
Dennis?
Yes.
Al?
Yes.
Gary?
Yes.
Scott?
Yes.
Marge? Gary T?
Yes.
Jimmy?
Yes.
Hank?
Yes.
Chris?
Yes.
And next would be the treasurer's report. Everybody reviewed that. If there's any discussion, or if there's no discussion, I'll entertain a motion to accept the treasurer's report. Okay. Dennis made the motion.
Second.
Second.
Al?
Yes.
Jerry?
Yes.
Scott?
Yes.
Marge? Gary T?
Yes.
Jimmy?
Yes.
Hank? Chris?
Yes.
Dennis?
Yes.
Okay, first up here is Baxter Health, Fulton County Hospital would like to give us an update on the latest going on with the hospital. Thank you both for being here.
Appreciate you having us. I know we've spoke to this court a lot, and this is really just kind of a quarterly update that we agreed to try to remain as transparent as possible with the county and answer any questions anybody has. You know, at the hospital here recently for the last several months, I introduced Easy at the last board meeting as the new full-time administrator at Fulton County, Baxter Health, Fulton County Hospital, and this dude hit the ground running. I mean, it's really surpassed my expectations. I've been able to pull back to Mountain Home to do my other full-time job over there, so very appreciative of that, but I'm still getting to come over here, still getting to be very involved with the hospital here in Salem. So just very thankful for Easy and the work he's done. Ron, our CEO, Debbie, our CFO, apologize they couldn't be here tonight. We had a medical staff meeting that they had to be at, but they sent their best as well. I'll just kind of touch on the financials that we presented to the judge, and then I'll let Easy run with it since he's the boots on the ground. So, happy to report that after the first 2 months of 2025, which were operational losses at the hospital, the last 4 months, we've been in the black. It's like I was talking about earlier, nobody's getting rich over there, but you know, we're not in the negative, we're not losing money, so I think that's a great thing, and a lot of the initiatives that we put into place over the last 2 years, a lot of them are really starting to come to fruition, and a lot of different things going on at the hospital. I'm not going to steal Easy's thunder, so I won't talk about them, but just very happy that the hospital here in Salem has a positive bottom line right now. We're still trying to meet what we budgeted. So those first 2 months having operational losses are usually really hard to make it up in a hospital budget, but we're within, I think, $20,000 of doing it. So as long as we stay on the path we're on, I think we'll meet the budget we laid out, which it's always kind of a stretch. You want to be real, but you want to push yourself as well. So I'd be extremely happy if we did that. And let Easy tell you about the goings on.
Thank you. We probably would be meeting that budget. We've had to do some things to be competitive from a wage standpoint. We adjusted some staff wages, adjusted physician wages to attract some new positions into our emergency department. We have 2 new positions that started actually have emergency department experience, and they're filling up our schedule for the ED through most of the month, and some others filling in from private practice. So we're happy to have them there. They seem to be well received by the community and by patients. I think our reputation is turning around. We still have a little negative feedback on social media. You're always going to have that, but we're also having some people coming to our defense now. So really happy to see that. Some of the good things we're doing there. We launched our IOP program, which is an intensive outpatient program, which is a therapy group for seniors. So we bought a brand new nice shiny van with a wheelchair mounted it. We'll go to all points of the compasses within a 30-mile radius, pick them up, they'll come in for sessions, get therapy on grief, finances, anything that a senior might need. That's going really well. We have about 7 or 8 full-time people in that program right now, and they really seem to enjoy it. And I think that's going to take off and be a really good thing for the community. Second phase of our electrical projects, we've got the generator up and going. Now we're identifying what's going to go on the generator and updating the wire within the hospital, which is not up to code in some places to be connected to that generator. So we're working on that. A new data center. So we'll have a new data center for the hospital and a backup off-site data center for Baxter Health. And that'll tie us into the same network. Right now we're split, which causes some grief on the computer network side. We've had a lot of donor activity in the last couple months. We've had donations for new kitchen equipment, new beds, new IV pumps, fix leaky through wall units that we have in the hospital. So we feel really fortunate that we have folks that want to come in and donate to the hospital. And the reason behind that is they say they may end up in there someday, so they want to make it better for when they do get there. That's just some of the highlights that I have. If you have any questions, I'm happy to answer them. If you ever want to come up and visit and ask any questions or just take a tour, be happy to do that as well.
I have a quick question.
Sure.
So as your relationship with Baxter has developed, have there been some services that you see more of or less of?
We see more event patients over here. So we have an admissions coordinator on our side. They have one on their side. So they try and send us patients that are good for us. We try and send patients that are good for them.
So an example of that would be, say, somebody had a pretty severe stroke. They're in the hospital at Baxter. When we stabilize them, we get them stabilized to the point they need to go to a higher level of care, which we have at Baxter. We have an acute rehab unit. I was actually the director for 10 years before this position. We would consider that patient maybe too low level. They're not able to tolerate the 3 hours of physical occupational speech therapy required for an acute rehab admission. However, now that we have the swing bed option at Fulton County, the therapy requirements are much less, I believe, an hour. So we can send that patient to Fulton County, have them there as a swing bed patient for usually it's a couple weeks is our average length of stay in that program. Then when that patient finishes the program, if they're still not ready to go home, hopefully their tolerance for therapy has gone up. We can send them back to Mountain Home to give them more rehab before we send them home, hopefully with just home health or something like that. So it's been a job and taken a long time to work processes out, but we're in a really good place with it now, and it's, I think, just very beneficial for both organizations and of course the communities for sure.
I assume when they came in with a stroke, we probably send them to Baxter or.
Yes, if they came into the ED here, they may go to Baxter. They may likely they'll go somewhere else. Usually they'll go to UAMS, Springfield, or Northwest Arkansas, and then a lot of times they'll transfer back to Baxter, and then we could route them back this way and then back that way after. I mean, it sounds like a lot. It is a lot, but it's very beneficial to patients like that, specifically the stroke patients.
And we do have a stroke program where when they come in, we have a telestroke program. So we can connect with a bigger hospital, they can evaluate them, we can figure out where we're going to send them. Endoscopies are another big one. Baxter's kind of backed up on some things. we're offering some of those services here, so we're really seeing that volume increase. We're seeing a range of patients spread out from farther away areas, and we're starting to see a lot of people come to our emergency department because they know that they can come here and they can get through really fast. So people are willing to drive 30, 40 minutes to come over and have a quick visit.
Done it myself.
We are doing the colonoscopy.
Yep, every Wednesday we do colonoscopies. We do between 11 and 13. There may be potential in the future to spread that to another day. Laundry is another big one. We were sending our laundry to White River and paying them to do it. So now with our partnership with Baxter, they take care of our laundry. It's been much better for us.
One of the other big things that we didn't mention, that it was one of the bigger complaints I started hearing when I first came over here to Salem, had to do with the clinic. So the clinic is currently provider-based space, which means it's considered a department of the hospital. So for billing purposes, the patient will get two bills. They'll get a facility fee and they'll get a professional fee. And that's a huge dissatisfier. Obviously, you have other more established clinics like Scribner and the others. Your wife's here in the area that don't do that. So it definitely was a problem. So I think I may have mentioned last time I was in here reporting that we were in the process of converting to a rural health clinic. So we had our inspection, passed our inspection, and just got word in the last couple of weeks that that's been approved. So we're in the process of working with the state and Medicare to get that switched over. So hopefully that'll be another barrier removed for patients coming to seek care at the clinic over there.
We're doing wound care as well, and we have an orthopedic provider coming over once a month, and he'll see 14 or 15 patients in a day. So we hope to continue to be able to keep growing those services. We have a floating space for the clinic that we can use for that, so those plans are in the works.
Can you speak to the mental health services that just started some months ago?
Yeah, the IOP, that's what that is, and as part of that counseling service to those seniors, they also have access to a psychiatric advanced nurse practitioner if they do need any medication or medication management. We have one on staff now, so it's, it started off slower than we would have liked, but it's really ramped up, and like Easy said, 7 or 8 patients, that is about the max that you can have with one therapist. So we're likely going to have to expand that program pretty soon. And the fun part is always looking for the space to do it. Hospital real estate is very sought after and limited by the people within the hospital.
Yeah, we're starting to have to consider what is best for the hospital and what are we going to do. We're also looking at a sleep study program, which would help with the 2 or 3 month backlog over at Baxter. We could have patients come and do sleep studies here, and that would help with, breathing issues, CPAPs and all of that. I think there's going to be a pretty good market for that.
A lot of exciting stuff happening.
Well, having been a patient of the hospital myself, I can attest to the excellent care that you all are providing, and certainly proactive in, any patient's concerns and things. I visit people in the hospital there, and always asking what kind of care you're getting, they give me excellent feedback, so we thank you for that.
We thank you, and thank this whole court, and thank the community and the county for all the support for the last, it's just over 2 years now since Baxter's come out here, and I've felt personally nothing but support from everybody in this room, the community, since I've been here. So we really appreciate that.
Okay. Thank you, guys. Anybody got anything else? Warren? Okay. Thank you, Anthony and Easy.
Thank you.
All right, thank you all. Have a good evening.
Okay, before we continue, it's going to be active campaign season coming up. Started pretty early, but we have some candidates here I want to recognize. So the Honorable Holly Meyer is here. Thank you for coming, Holly. We have candidate Tommy Kendrick here, and we have Kimberly Eddington here, and we have Kara Byers, naturally, and we have Heath Everett running for county judge. Okay, and we'll hear. we'll hear from, another person here, Jeremy Langston. He's gonna give us a FEMA update. Jeremy and I and Kelsey was with FEMA up here this morning, 10 o'clock in the morning, for about 3 hours.
It was a good brief meeting. They've kind of changed the way they've done stuff again, so it's kind of made it interesting. Fortunately for us on this go around, the lady that will be walking through the next few steps of getting some stuff submitted to hopefully get some reimbursements coming is from Region 6 with FEMA, which covers Arkansas. She actually lived in Springdale for a while. She lives in Sherwood for a while. Currently, she's down in Texas and kind of in that part, but she's here with us now. She's got a partner in Sherwood and she's covering Fulton, Stone, and a few other counties. So far, we're like the biggest candidate that she's got. We've had the most damage for many of them that they've dealt with on this today. 80, almost 90 something roads we've got listed in this. Somewhere today, we've kind of come up with 20 something roads that we've got snowball estimate on the dollar amount on that, which will, if it's completed work, we get that punched through, hopefully get some reimbursement on it, but we're somewhere between 400,000 and 600,000 on that, we'll get 75% reimbursement on that. That's gonna be a big shot in the arm, to get some of these big projects pushed through and hopefully fixed. That's kind of been where we're at. Hopefully this stuff, we're supposed to be getting some boots on the ground to go look at some of these site surveys to assess the damage, look at the scope of work, if there are things still be needed, to basically kind of give us an estimate of what work needs to be done to get it back to where it was. They're supposed to be here first week of September to get started on it. They're working in on the program, kind of coming across this way, and we kind of want to get them, and they want to make sure that they're not going to miss something when they get here. This has been a long process, but I know in the year past when we had the tornado that didn't affect near as many of us, I was working on this stuff plumb through August into September, and it was what made that happened. So hopefully this will start progressing a little faster. The lady we're dealing with on this one has offered to even come up here and sit to punch stuff in computers, and that stuff that normally doesn't happen. But she's offered, she even told me today in an offline conversation that if I need her at 10 o'clock at night, shoot her a message, call on my cell phone, but she's up most time she lives on her phone. Most of these folks work up to quit time, and that's it. You don't get them any in off hours. So hopefully she's going to do us a great job of getting some reimbursement back in the county.
What's the latest on Bible Road? The Bible access road? What
Like-
lane's still in?
Like as far as
Yeah, working on it.
working on it, we played it the other day, got it kind of back into shape, or you won't know about the FEMA, or not the FEMA, but the Canada Food.
Yeah,
Yeah, that was one of the things of, we were told that we missed it last year, that we was gonna get it this year, and then that didn't happen, we missed it by that much, as the old saying goes. Super proactive on this time, we're gonna kind of get them off, they can't refuse on it to get it done. It's, never I can remember to say, hey, if you submit it just like this, we're gonna help you out, and it doesn't happen that way.
So we'll resubmit that in January, and then the discriminating factor was, in-kind contribution, okay? Because it was 75-25, but if we increase the contribution, the county side contribution, we get more points for that, and we got some.
Yeah, they said that there was no set portion that the county was supposed to put up, but then that would come to the side factor of how much money we were gonna put towards the project ourselves, how much labor, how much equipment we would put forward. It's not supposed to be a determining factor, but it becomes a determining factor. So that kind of where we got shot foot on that.
I actually talked to them about another matter, but ended up talking to that lady, and we did just barely miss the match. So
Yeah.
maybe if we do increase it, maybe I think we get preference
That's,
points. for-
well, we'll certainly do that.
And, yeah, it's one thing we're going.
I mean, what she described, she didn't do a dollar amount.
No, it
Fulton
was-
County barely,
If
Sharp
it was-
County missed it by a mile, but we barely,
Yeah.
anyway.
Yeah, we've had them conversations, that it was really sad how close it got. but it ended up knocking us out by eight spots. But that answers on that one. I thought we missed it, but we're still maintaining the road, trying to get it back in some shape.
Okay, anybody got any other questions for Jeremy? All right, thank you, Jeremy. Okay, next up, we're just gonna freaking get through this. Our library, there's been a change with our library, the association was, we were under the umbrella of White River, Regional Library Association. So that is disbanded, and so, you know, nobody really knows who's, you know, what umbrella our libraries are under. You know, is it the Department of Education, is it the Department of State? So I made a call to the governor's office, spoke with the Education Policy Administrator, Kara Kennedy, and she's gonna give me an answer on that tomorrow. Thought I'd have an answer on it today, but anyway, and she'll find out, you know, what's going on with the library board at the state level, and we should have an update on that. But in the meantime, our libraries are controlled by the library board and my office. Okay?
When you say that it was disbanded, why was it disbanded?
That's a good question. Jeannie, do you have any idea?
Not a clue. They didn't give us any kind of heads up, and they just were closed under the Department of Education. That was it, that's all. And that didn't come, that was hearsay, that was not something they sent us and said,
Yeah, okay.
this is gonna happen. So,
Okay,
yeah,
so
we
we
haven't
just have
really-
to kind of roll with it and figure out as the information is disseminated down to us. But it doesn't affect the operation of our libraries to this point. Next thing, talk a little bit about public facilities. We had the Fulton County Stoneworks here at the airport that was substantially behind on the rents, and so they were served an eviction notice. And Dwayne Plumley did a lot of that for the Public Facilities Board, and then Eric came and cleaned it up, and then we got them finally out of there, put new locks on the facility, so hopefully, Public Facilities Board will clean it up so that we can attract some other industry into that facility. It is a big mess right now, but it's salvageable. Okay, anybody got any questions on that? Any discussion?
Is anybody running the airport right now, or what's going on
I have no idea about the airport.
No, it's not the airport, it's
It's
the building.
It's the
across
building.
the road.
Yeah,
Oh, okay.
used to be the plastics place.
Yeah.
It's an industrial building, it's, oh, I'd say 10 to 15,000 square feet facility. It was a real nice facility years ago, but hopefully it'll return to that. Okay, what we need to do is, we need to appropriate $15,000 for the Sturkey Fire Department. They did a grant for breathing apparatuses. So that's the first up. Okay, I'll make a motion. Then seconded.
Gary,
Yes.
Scott,
Yes.
Marge,
Yes.
Gary T.
Yes.
Jimmy,
Yes.
Hank.
Yes.
Chris.
Yes.
Dennis.
Yeah.
Al.
Yes.
Okay. Motion passed. Next thing, we'll talk about, federal rewards policy. You take a look at that, I put it on everybody's, front of you there, and that is how we, when we receive federal awards, money, and how we handle it and everything, so we'll have Vicki read that. And then y'all approve that policy.
Policy for federal awards. Fulton County, Arkansas receives federal awards for various programs. It's the county's policy to assign each award to a competent individual in the related departments to oversee the funding and expenditures. That individual will ensure that the county is complying with all the requirements of the individual award, including but not limited to allowable costs and activities, eligibility, monitoring, recording, and sub-receipt monitoring. Furthermore, the county will comply with all state and federal laws, guidelines, and mandates on government-issued funds. The county treasurer will be responsible for reviewing the total amount of federal expenditures on an annual basis to determine if the audit is required in accordance with uniform guidance. All invoices will be reviewed and approved by the responsible individual before being submitted to the clerk to process payment. The treasurer's office signs all checks and reconciles the bank accounts.
Okay, can I, entertain a motion to?
As I understand, this is what we're already doing.
That is
right.
correct, but we need a formal policy approved by the Quorum Board.
I'm moving the adoption of the policy.
Okay, and also, okay, so Gary made the motion, and it looks like Scott seconded. Then I'll explain it once we,
Scott?
Yes.
Marge? Gary T?
Yes.
Jimmy?
Yes.
Hank?
Yes.
Chris?
Yes.
Dennis?
Yes.
Al? Gary?
Okay, so what you have attached is our federal audit. What happened was during the congressional audit, it was found that, our spending had reached a level that required a federal audit. And that's what this is, and, has the flying colors, and, that's what you have in front of you. Okay, no findings, noted, and it was submitted, certified by myself, and submitted to the Department of Treasury. We should be getting the results from the congressional audit sometime early next month. Okay, next we go to, asking for appropriation for $37,444 for rural roads grant to repair road runner.
How much?
$37,444.
To repair what?
Road runner. It's out by Mount Calm, up on, Dove Road and Road Runner.
It's a rock area.
Okay,
It's all.
Chris made the motion,
Okay.
Dennis seconded.
We know the road.
Hold on just a minute.
This is a grant.
Yes, it's a grant that we have been, approved for.
Marge? Yep. Gary T?
Yep.
Jimmy?
Yes.
Hank?
Yes.
Chris?
Yes.
Dennis?
Yes.
Al?
Yes.
Gary?
Yeah.
Scott?
Yes.
Okay, and the next one is, need to appropriate $3,500, and that was the proceeds from the recycled trailer we sold to the city of Biola. And what happened was, we had that trailer that we were parking, and we have to retrieve it, take the dash flat every week. We no longer have to do that. Biola got a grant to purchase a truck and the trailer, and so what I want to do is appropriate that money to go to building materials and supplies. With what we got going on, the old sheriff's department now has been demolished on the inside, it's been cleaned out. And so we need a little bit of money to get back in that facility. So next thing we're gonna do is we're gonna paint it, okay? And then the federal building is gonna get some paint. Okay, Al made a motion. In a second.
Gary T?
Yes.
Jimmy?
Yes.
Hank?
Yes.
Chris?
Yes.
Dennis?
Yes.
Al? Gary?
Yeah.
Scott?
Yes.
Marge?
Okay, next is, resolution authorizing an increase in the amount of lodging reimbursements.
Resolution number 2025-05, be it resolved by the Quorum Board of Fulton County, State of Arkansas, a resolution entitled, "A Resolution Authorizing an Increase in the Amount of Lodging Reimbursement to County Employees and Other Purposes." Whereas the county travel policy on Section A currently states that any county official and employee shall be entitled to receive a daily allowance for lodging for an individual while traveling within the state of Arkansas at a rate of not to exceed $125 per day. Whereas the Fulton County Quorum Board has determined that due to the increase in the price of rate of reimbursement for lodging for county employees be increased to an amount equal to the rate of $175 before taxes and fees. Now therefore be it resolved by the Court of Fulton County, Arkansas, that the amount of lodging reimbursement for Fulton County employees be increased from $120 per night to $175 per night. Resolution 2025 is to be effective as of August 1st, 2025.
I'll make a motion.
Can be made motion?
Second.
Al seconded. Okay.
Jimmy?
Yes.
Hank?
Yes.
Chris?
Yes.
Dennis?
Yes.
Al?
Yes.
Gary?
Yes.
Scott?
Yes.
Marge? Gary T?
Yes.
Any resolution passed. Okay. Next up is appropriation for $15,000 for the purchase to pay for the federal audit we just had done.
What?
15,000.
Thank you.
That audit that you have, $15,000.
We don't have a choice.
No.
90 days. You made a motion? Scott, make a second.
I will.
Oh,
Dennis.
Chris,
Dennis.
Dennis, second.
Hank?
Yes.
Chris?
Yes.
Dennis?
Yes.
Al? Gary?
Yes.
Scott?
Yes.
Marge? Gary T?
Yes.
Jimmy?
Yes.
Okay, that basically concludes this evening's business. We do need an appropriation. You got it totaled out?
Total appropriation for tonight is $70,944, and this will be ordinance 2508.
I'll second.
How much was that amount again?
$70,944.
Chris made the motion, Gary seconded.
Chris?
Yes.
Dennis?
Yes.
Al?
Yes.
Gary?
Yes.
Scott?
Yes.
Marge? Gary T?
Yes.
Jimmy?
Yes.
Hank?
Yeah. Okay, last up here, if, any public comment there, Honorable, Holly Meyer, Judge Meyer, would you like to speak?
Maybe 2 minutes, I'll say.
2 minutes.
My name's Holly Meyer, I'm a circuit judge. The challenge right now is we've got 9 people running for 4 positions as circuit judge. How to make people care about who's the circuit judge? Well, if you're in court, it matters. If somebody's taking block easement to your farm, if somebody sold you something and it's defective, if somebody sold you something that hasn't paid for it, you've been in a car accident, the insurance company won't pay. All those reasons are civil reasons, they're in my court, and they're reasons why you should care about who the judge is. So I've been your judge for 9.5 years, I'm applying for my job again. So I'm asking for you to re-elect me. I'm from Heber Springs, I went to law school in Little Rock, I met my husband. My husband completed his residency, he's a family practice doctor. We moved back to Heber Springs, where we raised 2 boys in 4-H and instituted sports. There, I built a private practice and I served as a deputy prosecuting attorney. While I was still in Little Rock, I was a senior homicide prosecutor with the prosecuting attorney's office down there. Yeah, we moved up here, served on the Access to Justice Commission, served on the Arkansas Sentencing Commission. I've served as an special associate justice on the Arkansas Supreme Court. So I've distinguished myself as a capable trial lawyer. I've been your circuit judge for 9 years. Before that, I was actually the prosecuting attorney for 2 years. I've prosecuted several jury trials in this very courtroom. It doesn't look like it used to do, and I'm so proud of how it looks now. But I would ask you to consider putting me back in office. I think I've handled myself with integrity. I think I've handled myself straightforward. I have a good reputation. I'm courteous to people in court, and I am a no-nonsense judge. And if I'm your lawyer and I'm fighting for you, I'm fighting hard for you. You can ask Al Walker, he's one of my clients, as the sheriff. So I ask for your vote. Appreciate your time.
Thank you, Judge.
I tell you, she was a prosecutor for a while, and she's been judge for several years, and she's very intelligent, she's very fair, and she listens carefully, and she's had hands to do decisions, and she should have done it with dignity. My advice to everybody is, don't be fixing something that's not broke, because it ain't broke, it's as good as you can do right now. But you can't do that.
Thank you, Sheriff.
And I'll echo that, she was very good to our agency, and I used to work for her too, so.
Appreciate you, Judge, for this court.
Anybody else would like to talk here?
Briefly, you guys have given me the honor of talking here before, so I'm just gonna keep it a little brief. I'm not gonna go into all my experience and everything that I talked about last time. I just wanna reiterate that what I am fighting for, bringing resources here to our community for veterans, for mental health, resources that our community is lacking that require a circuit judge in order to get the ball rolling on that with the mental health court and the veterans court. I'm here tonight to ask not only for your support and your vote on March 3rd, but we also have to get a certain amount of signatures, a very large amount of signatures, just to get on the ballot. So I'm asking before you leave today, if you would sign my petition.
Kimberly?
Thank you guys.
Tommy?
Good evening. My name is Thomas Kendrick. I'm running for Circuit Judge Division 2. And just to tell you a little bit about myself, I grew up in Conway. When I was in law school, I clerked at the Public Defender's Office in Little Rock. That's where I met Tammy Hare. She became the managing public defender in our district in 2013. That's when I started working in the district in Independence County. I moved to Heber Springs in 2014. I primarily do Independence and Izard County, but I'm in Fulton and Stone and Cleveland counties a bunch as well. Doing the public defender caseload, one of the things that I would say about why I think that's important is because every court date I get new clients. Attorneys in private practice, if they're too busy, they can say, hey, I'd like to help you, but I don't have time, you'll have to find another attorney. So as a public defender, every court date, you get new cases, and so you have to learn the skills to handle a very large caseload. Those are the same types of skills that as a judge who oversees all the cases that you would have to use to be able to move through a docket efficiently, be able to figure out what's really at issue here, get a solution for it, and move on, because the longer cases take, the justice is denied, and the cases take years and years and years. The other thing I would say is that having such a large number of cases, I've seen all sorts of different issues. So whether it's a civil case, a probate case, a domestic relation case, the issues and the people involved in those cases, criminal cases have those same people and those same issues which lead to those others. And so having dealt with so many cases over the years and seen all those different issues, there's not a lot of stuff I haven't seen or seen something similar to, and those are skills that I think are beneficial as a judge. You want to have that broad experience of seeing a whole bunch of stuff. But the other thing I would just say very briefly about why I actually did decide to run is because over the years I have grown very frustrated seeing the same people year after year after year coming through our court system. I'll represent someone a couple years later, they're back with the same sorts of things. One of the major reasons for that, why we see repeat criminal behavior in people, is drug addiction. So in 2013, when I started working in the district, I started working in the drug court program. It was presided over by Judge John Dan Kent. Back then, he started it in Batesville and spread it to the whole district. And the drug court program is something I'm very passionate about because it actually addresses that cause of why we see people come back again and again to try to break that cycle so that we don't have future victims. When they get out and they go back and do the same stuff, if you can break that cycle, you'll have future victims. You help reconnect families, you rebuild families. I think that makes our community better and our community safer. Before he ran for the Supreme Court, Judge Kemp added a veterans treatment component to our drug court program, where he actually had agreements with the VA where we could have, they would come to our staffings and they would provide information. We could have, when veterans were in the program, they could utilize those resources. Those agreements after he went to the Supreme Court were kept up, so we've lost that. That's something that I would like to bring back. Also mental health issues. A lot of the clients that we see coming back again and again have not just substance abuse, but other mental health conditions. Our district really struggles with that. There's not a lot of mental health providers. We're very rural, so it's hard for people to get to those appointments, but I think the court system can do more and should do more to try to address that need. And so those are really the reasons that I decided to run this, because I think that it's being a judge, it's not just about being a judge and sitting up there and presiding over cases, but it's about giving back to the community and doing things that make things better for all of us. So I would appreciate your consideration on March 3rd. Thank you so much.
Thank you, Tom.
consider, I know that county got radios a few years ago. Our department still doesn't have a tower, so we can't purchase radios. We service Fulton and Sharp County, majority of our district is Fulton County. However, when, we're trying to get out, we have trouble dispatching anywhere because we can't afford radios to service both counties. And we don't have a repeater for Fulton County still, when the other parts of the district got repeaters. We did not get anything in our district, and we've been asking for a long time. And we do not have that, and we feel that our constituents that we represent in our district deserve to be able to call 911 and get assistance, and us to be able to communicate with others to get them that assistance they need. Myself, for instance, I had a stroke a few weeks ago, and when I call 911, I get Sharp County, and they tell me I need Fulton County. And I live in Fulton County. Okay, so then we have to go through that. Same thing happened not a week later to another party out there, an older couple. Her husband had a stroke, same instance happened. So we need a fix out there, and we need y'all to help us with that. We have the money to purchase radios, but we can't afford radios, $1,500 radios, because that's what we're gonna have somewhere in that neighborhood to do both counties appropriately. So we need something there and
Okay.
to help us.
Angel, can you give us an update on that, or what's happening with that?
So yeah, so with the repeater issue, that is an issue with Sharp County and Fulton County. There is not a site set up for designated 9 Ridge Party area. I'm working with, Adam Fugate with an area that will bounce back for 9 Party and hit that way with dictation. She is incorrect on the part about calling 911. Yes, she does get service. The issue with that is they're still analog for Sharp County and their radios are analog. So Sharp County has to page them out. We do get the 911 call in Fulton County. Sometimes with the weather, it could bounce to Sharp County with a wireless call. Either way, they will get paged out and get assistance.
Okay.
So it's a timely process, but it's gotta take time. I have to work with Sharp County, what was it, Worth Road maybe, or to.
It's on the Star Tower, it's one of ours all over the house, it's up there.
Okay. Okay, so when's the last time we talked to Adam Fugate?
Last week.
Okay, very good. All right. Okay, anybody else got anything else?
So we have a time frame on it, because I've spoken with Adam myself several times. And the last time I was told that y'all had spoke with Adam, Adam had not heard anything. I'll be glad to pull the email up and read it to you all if that's what we need to do.
Yeah, I'll follow up with you tomorrow morning, okay?
And
Well, when she was having her stroke, we were almost to heart. So how is that in Sharp County?
That, I don't know, that may be an isolated issue that we'll have to work on. I
Yeah,
was
that's-
not aware of that at all.
Oh, trust me, I know where we was at.
Oh, I'm not arguing, saying
No,
that.
I'm just saying
Okay.
that's incorrect, what you
That's
just
not-
said.
That isn't anything we're in control of. We
No.
don't control ourselves.
No, I get that, that's all on cell towers.
Right.
I get that, yeah.
Certainly apologize for that. We gotta react to the 911 calls and emergencies. So we need to improve that way.
I will say too, that when that happened to Angela and beforehand, they had a possible fire at their home, we, as the 9 people, knew nothing about it. We were not texted about it, dispatched about it, we had no idea what was going on.
So with that, Sharp County controls 9 Ridge paging them out. I'm not over the Sharp County dispatch on their training, on if they page them out, if they repage it out to verify. That is under Shane Russell and them. That's why I'm trying to get it all in one position, so it's monitored.
I guess I have a question as well. Why would we not communicate between the counties to what kind of 911 system we're using? Instead of just going willy-nilly, whatever you want, you get. Instead of communicating between the 3 or 4 counties. It don't make any sense to me.
We invited them to purchase that as well. They refuse, each entity can get whatever they want. They don't have to communicate.
That makes no sense.
It doesn't.
If can they not just get one local jail and do that instead of building $1 million jails in all these other counties? It makes zero sense, guys. You're just
Okay, we're
chasing money.
kind of getting off course here, okay, so it looks like that's where this thing has gone, so any other discussions on any other subjects? Okay. If not, I'll, accept the motion to adjourn.
So.